a very interesting topic of pharmacology, which is very important for your basics of pharmacology, which is route of drug administration. Now the question is, what is drug administration? Drug administration is giving of a drug by one of the several means or routes. Now, most of the drugs can be administered by different routes. Drug and patient related factors determine the selection of routes for the drug administration. These factors are characteristic of the drug, emergency routine use, site of action of the drug. It is local or systemic. Now, condition of the patient, where the patient is unconscious, vomiting, diarrhea, associated disease, and age of the patient, and sometimes patient's or doctor's choice. Here this image shows the different types of routes of drug administration: oral, sublingual, intramuscular injections, epidermic, topical, inhalation. Now the classification of route of drug administration. Route of drug administration is local or by systemic. In local, topical route of drug administration, deeper tissue of drug administration, and arterial supply of the route of drug administration. In systemic, antral route of drug administration and parenteral. In antral, oral route of drug administration, sublingual route of drug administration, rectal route of drug administration. In parenteral, inhalation, injections, and transdermal. Here the image shows the different types of route of drug administration. Now the local route of drug administration. It is the simplest mode of administration of a drug at the site where the desired action is required. The systemic side effects are minimal. Now the topical route. Topical route, drug is applied to the skin or mucous membrane. It is applied on the skin or mucous membrane as an ointment, cream, lotions, or sprays. For example, suframycin, we use suframycin on the skin. Now, intra-arterial route. Close intra-arterial injections is used. For example, the diagnosis of these, for example, administration of some anti-cancer drugs for the treatment of malignancy involving the limbs. Now the administration of the drug into some deeper tissue. Deeper tissues can be approached by using a syringe and needles. For example, intrathecal injections and some injections directly into the joint space in rheumatoid arthritis. Here the image shows the injection rheumatoid arthritis. Now the systemic route. Drugs administration by route enter blood and produce systemic effect. Now antral route. It includes oral, sublingual, and rectal routes. First, the oral route. It is the most common and acceptable route for the drug administration. Drug forms are tablet, capsules, syrups, and mixture. For example, paracetamol tablet we use in fever. Now, the image shows the oral route of drug administration. Some advantages of the oral route of drug administration is it is safer, cheaper, painless, and convenient for repeated use and can be self-administered. Some disadvantages are it is not suitable for unpalatable and highly irritant drug, unconscious patients, and patients with severe vomiting and diarrhea. Now the sublingual route. The preparation is kept under the tongue. The drug is absorbed through the buccal mucosa, membranes, and enters the systemic circulation directly. For example, nitroglycerin for acute attack of angina. Some advantages are it is quick onset of action and bypass first pass metabolism and self administration is possible. Some disadvantages is it is not suitable for irritant and liquid insoluble drugs and drugs with bad taste. Now rectal route drug can be given in the form of solid or liquid. Now for example enema can be used for local effect as well as systemic effect. Example diazepam for the epilepticus in children's. Now here are this image shows the sublingual route and the buccal route. Now the parenteral route of administration other than enteral route are called parenteral route. It is generally referred to the injections. Some advantages are onset of action of drug is faster, hence it is suitable for emergency, and it is also useful in unconscious patients because we cannot give in orally. So it is very useful for unconscious patients, uncooperative and unirritable patients, and patients with vomiting and diarrhea. We also use parenteral route. It is also suitable for irritant drug, but some disadvantages are it is required aseptic conditions and preparations should be sterile and are expensive and cannot usually self-administered. Now injections. First, the intradermal injections. The drug is injected into the layer of the skin. For example, BCG vaccine and sensitivity test. And next is subcutaneous. The drug is injected into the subcutaneous tissue of the thigh, abdomen and arm. For example, adrenaline and insulin. This image shows different angles of the intramuscular, subcutaneous, intravenous and intradermal injections. Now intramuscular. Drugs are injected into large muscles such as deltoids, gluteus maximus, for example paracetamol and diclofenac. Now intravenous drugs are injected directly into the bloodstream through a vein, and the example is intravenous example is the normal saline. Now inhalation. Volatile liquid and gases are given by inhalation for systemic effects. For example, general anesthesia. Here the image shows inhalation. Now some advantages of inhalation is quick onset of action and dose required is very less. So systemic toxicity is minimum and amount of drug administration can be regulated. And some disadvantages of inhalation is local irritant may cause increased respiratory secretion. Now transdermal route. Transdermal route, the drug is administration in the form of patch or ointment that delivers the drug into the circulation for a systemic effect. For example, nitroglycerin patch or prophylaxis of angina. Here are the image shows the transdermal patches. Some advantages of transdermal patches are self-administration is possible, the duration of action is prolonged, and the systemic effects are reduced. Now it provides a constant plasma concentration of the drug. And some disadvantages are it is expensive, local irritation may be caused, and for example itching, and the patch may fall. That's all for today's lecture. Thank you.